when you're in an auto collision, you may have some pre-existing conditions, you may not, but the accident certainly will cause current problems as well as possibly future problems, and we want to learn to minimize those problems. So whichever angle you're hit from, we want to take different x-rays and pictures in those angles. We usually can take up to possibly 11 x-rays in the neck if necessary to detect these problems where maybe somebody would take very few x-rays and not see these types of conditions. So what we have here is a diagram that kind of shows the phases that someone goes through in a car accident. This is a normal forward curve of the neck. This person's standing facing this direction. This is a reverse curve in the neck called phase 1. And this is when arthritis can start setting in within up to 6 months after an accident. This is another phase called phase 2 where the arthritis and the calcium starts to build up on the vertebra from years of not being taken care of properly, and it can lead to full fusion, which is phase 3. Okay, so at this phase we can keep you from progressing, but it's hard to get someone back and almost impossible back to normal. If you can catch it in this phase, which is what we're trying to do, is get to your accident early, preferably in the first 2 to 3 days before scar tissue begins. Okay, but in Florida you have up to 14 days to be evaluated from a car accident or a car crash.
This machine is called an interferential machine. You could hook 2 patients up at the same time. You could actually put it throughout your neck, mid-back, low back, and you could actually take the inflammation out of the spine a lot easier. It helps the tissues heal faster. It's therapy after an injury. It helps tremendously when you're suffering with pain. It gets rid of sciatic pain, gets rid of inflammation, and it helps the muscles relax.
Another thing I want to talk to you about today is disc problems. When we're dealing with lower back, specifically lower back disc problems here, which a large portion of the population deals with at some point in their life. It is the #1 surgery in the United States is low back. So in helping disc problems that can occur in the spine, we have a table that is facilitating the healing of that. And part of the treatment is called Cox Flexion Distraction, COX. And we can push this button here, would allow this table to come down, and we distract the low back joints in order to allow the disc to heal properly. And this is a very gentle, non-strong force technique that has been around chiropractic for a while, and the technology and the tables have come a good distance to help the practitioner to heal these kind of problems.